So pharmacists ensure that we use our antibiotics appropriately and then we do not misuse them. We also ensure that we check for the appropriateness of the antimicrobial for a given indication. In the clinical setting, we ensure that the patient's drug chart has a clear documentation of the indication which requires a particular antimicrobial. Creating awareness is important in our fight against antimicrobial use. So we do patient and as well as healthcare professional education and training to create awareness about the appropriate use of antimicrobials. It's important that you take your antibiotics as prescribed. This means that taking the right dose at the right time. When your drug says twice daily, it does not mean morning and evening, it means 12 hourly. As well as when you hear 3 times daily, it's not necessarily morning, afternoon, and evening. It means every 8 hours. So important that you take your drugs as prescribed. Follow the right dosing regimen. For antibiotics that require reconstitution, it's important that you reconstitute the drug appropriately so that you have the right dose when you dispense the drug. If you're having challenges with reconstitution of such drugs, it's important to talk to your pharmacist. They are there to assist you and will reconstitute it for you so that when dosing your drug, you have the right dose. Also, discarding of our antibiotics, it's important that you bring them back to your pharmacy. The pharmacist will liaise with the FDA, that's the Food and Drugs Authority, for proper disposal of your drugs. So we'll do it proper and safe for you. It's important you complete your antibiotic course. Take your prescribed antibiotic for the correct duration. Do not stop even after you feel better after a few days. Complete your antibiotic course. Also, do not share your drugs. Do not share your antibiotics with other people. You might be dealing with different indications, even though you might present the same symptoms. Also, always talk to your pharmacist. Do not self-medicate. If you're feeling unwell, talk to your pharmacist. You're in the best position to give you the right drug, the right dose, and the right frequency.
Antibiotics are prescribed for specific infections, so using leftover antibiotics from a previous illness may not be effective because you may be experiencing a different kind of infection, and infections are caused by different microorganisms. Antibiotics are supposed to target specific organisms. So let's say your previous infection was an upper respiratory tract infection and now you're experiencing a UTI, the choice of antibiotics would be different. Secondly, the dosage and duration of therapy may not be appropriate because you have already used some of the medications previously and you need a full course of antibiotic therapy to eradicate the infection. It is necessary to complete the prescribed course of antibiotic therapy even when you feel better because the prescribed dose and duration is necessary to ensure complete eradication of the infection, because taking the medication halfway will only cause the microorganism to grow resistance, which will make the disease or infection difficult to treat in the future.